Docs Journal Club, your daily dose of health and medical news. I'm Isra Zaman, and today I'm going to talk about a systematic review and meta-analysis which deals with the prevalence and correlates of suicide and non-suicidal self-injury in children. Male individuals were at greater risk for self-injurious thoughts and behaviors in pre-adolescence relative to adolescence. Attention deficit hyperactivity disorder, child maltreatment, and parental support were especially relevant to suicidal ideation as well as depression for suicidal thoughts and behaviors in this age group. These findings have been published on 25th May in JAMA Psychiatry. Considerably less is known about self-injurious thoughts and behaviors in pre-adolescence than in older age groups, owing partly to the common view that young children are incapable of suicidal thoughts. Yet, pre-adolescent suicide has increased in recent years and is now the fifth leading cause of death in this age group, leading the National Institute of Mental Health to identify it as a priority for research and intervention. The researchers Richard T. Liu et al. Tried to assess prevalence estimates of pre-adolescent self-injurious thoughts and behaviors, identity correlates of these outcomes, and conduct head-to-head comparisons of pre-adolescent and adolescent self-injurious thoughts and behaviors in terms of associated characteristics. Medline, PsycInfo, and Embase were systematically searched from inception through December 23, 2021 for studies on the prevalence and correlates of pre-adolescents SITBs, that is self-injurious thoughts and behaviors. The search was restricted to English language publications and peer-reviewed journals. The lifetime prevalence of suicide in the general population was 0.79 per 1 million children. Prevalence for lifetime suicidal thoughts, suicide attempts, and non-suicidal self-injury among pre-adolescents were 15.1, 2.6, and 6.2% respectively in community samples. These data suggest that approximately 17% of pre-adolescents with suicidal ideation transition to attempting suicide. Across several analyses, male individuals appear more likely to have self-injurious thoughts and behaviors in pre-adolescence than in adolescence. Correlate data were modest for self-injurious thoughts and behaviors other than suicidal ideation, but among specific disorders, attention deficit hyperactivity disorder and depression emerged as the strongest correlates. Among interpersonal factors, child maltreatment and parental support yielded the largest effect sizes. The authors remarked that further study, especially of self-injurious thoughts and behaviors other than suicidal ideation, is needed. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.